Carla Page, and welcome to the Carla Page Show. Thank you so much for joining me. I'm so excited about this show. I have been planning with these ladies for maybe 6 months or more, but guess what? We are all together, thank the good Lord, and we are going to have a wonderful time sharing valuable, worthwhile, very important information for you. I have this week 3 ladies from the Cancer Services Program out of Fulton, Montgomery, and Schenectady County. Now, they're located at St. Mary's Hospital, Guy Park Avenue in Amsterdam, New York. They've been around for over 15 years. Now, the thing about it is I've had some of them on my show in the past, and I always try to keep up with them regularly because to me, I feel like I have my own partnership with them to be able to get the word out. And that's what it takes. If you know something, that's what it is. Then you can follow up with it. This show is the show also for those of you out there who do everything for everybody else, but you don't do anything for yourself. So I'm saying right now, stop and take care of yourself. Please, we want you around for a very, very long time. And it's easy to leave yourself behind. But this show is going to kickstart you into thinking, I have got to take care of me. Because if you don't take care of yourself, you can't take care of anybody else. So let me introduce my guests to you, okay? My guests are Suzanne Hagadorn. She's the program manager of the Cancer Services Program. I also have with me Kim Rodecker. She is the outreach coordinator. And then I have Carmen Rodriguez, and she's the case manager of the Cancer Services Program. And again, they are located at St. Mary's Hospital, Guy Park Avenue in Amsterdam, but they serve all these counties, Fulton, Montgomery, and Schenectady. Hi, ladies. Welcome.
Hi. We're great to see you.
I'm telling you, I'm like, all I could think about was I'm going to see and I feel like you all are my friends. I really feel like a friendship with you now. I do. Thanks for coming. Thank you all for coming. Suzanne, I'm going to start with you. Will you let the viewers, because we're going to do part 2. That's another thing. This is part 1, and then we're going to do part 2. So explain what your duties are, what you being the program manager. So what does that mean?
So as the program manager, I'm responsible for all of the pieces that go with it, the funding, making sure that we're getting reimbursed the correct dollar amounts for the services that we provided to the healthcare systems and individual providers that we work with. I'm dealing with all the billing issues. So anything, somebody might get a bill, and if you get a bill, make sure you call us. We tell everybody that if you get a bill, we make sure that that bill gets switched over so that it's in our name and the patient won't get that any longer. And then we reimburse for that. So I'm kind of like the paperwork girl, I'm shuffling around there and a little bit of everything. So
keeping us in line.
Oh, okay.
I have to keep up. We have goals and objectives of the program. So we're grant funded. And so there are goals and objectives so that we can keep our funding. So we have to make sure we're on task. So a lot of the work Kim does is part of that. Most of her work is part of those goals and objectives. And then we have percentages of screenings that we need to do. So then that's on Carmen a little bit. So Carmen's making sure these people are getting screened and we're meeting these goals and objectives as well. So
how long have you actually worked there?
I've been with the program for 15 years. And I've been in grants and advocacy for over 25. So this is just one of my roles that I've played over, the 25 years. So I was in tobacco advocacy prior. So we did a lot of anti-tobacco education with teens and adults both. So I got a little bit of a background there, and I rolled into this.
Sure.
So 15 years, yeah.
And I want to say to you publicly that you have always been the same to me, treated me the same. I've known you for a long time.
15 years.
I think it has
because I started out as outreach. So that's how we first met.
Yes, for 15. And you've always been the same.
Always loved being on your show all these years.
So I'm just glad to know you. Thank you for what you do for others.
Thank you.
That's means so much. And
I
know you've saved a lot of lives. I do.
I believe we have.
Yeah,
yes,
I know that.
Totally. Thank you. Appreciate
Sure.
that.
I'll come back to you. So, Kim. Hi, Kim. Remember I used to call you a lot, too. Remember? Didn't I used to?
Yeah.
Be like, this is Carla. So describe what your job is. What is the duties that you do?
Yeah, so I do education and outreach in the communities of Fulton, Montgomery, and Schenectady County. Going to different, I've been to different churches, food pantries, schools. I go to schools because people aren't just young parents. Sometimes they're grandparents who could be in their 40s or 45 or 50 or even 60s picking up their grandkids. So we try to get those folks wherever we can find them. I mean, I'll come to the grocery store if people are there that'll listen to me. So I go all different places to try to talk about the word, talk about the program, and enroll those folks so we can get them screened. So I'm out in the community. When I'm not, I'm in the office doing research. I'm on social media looking to see what events are out there and where we can go, who we can talk to. So it's just a lot of education and outreach to try to find those folks.
I love it. And do you find too, Kim, that a lot of times people, maybe they weren't aware of what you had to offer? Do you find that?
Yeah. Even in our own hometown of Amsterdam, they don't know. I forget, it was just somewhere recently, and the folks were like, we had no idea you guys were here. I'm like, we've been here for at least 15 years that I know of, but we've been here for a lot longer, and people really still don't know that we're here. So, we try to get out there. I do an educational at our new hire orientation at the hospital. So folks that are coming in know about our program either for their personal reasons or for the reasons of the patients. They're your patient registration, they're your financial counselors, they're your nurses and doctors. So they all need to know about our program. So if they run into somebody that's not insured, then they can tell them about our program, and we can get them out.
Sure. And I always say, ladies, that everybody knows somebody that knows somebody that knows somebody.
Yes.
Absolutely.
And a lot of stuff is word of mouth.
Yep.
And a piece of that too is that, we advertise. We do put things out there. Not everybody sees every avenue of it, whether it's newspaper, social media, internet, whatever it might be. So a lot of people miss different things because of how they view advertising these days. So we do, and they do miss out on what we offer. The other side is that most people, until they're looking for it, don't find out about it or search for it. So I think that's a big part as well. So this is piggyback. We need Kim out there to share that information.
Right. Or if you know somebody that needs your help. And then it's like,
And we have a ton of community partners between the three counties that we work with who will share our information. So we'll do a flyer for a screening here at Bellevue, and we'll make sure I get it out to everybody that's in that area, and they share the heck out of it. You see it on their social media pages, and we've gotten calls from it and saying, oh, I've got this information from Schenectady County Public Health, had your flyer, and I saw it. So, we work well with our community friends. Absolutely.
Beautiful. And you've been there how long?
Just a little over 2 years now.
Okay.
She's rocking it.
Seems like forever.
Rocking it.
Yeah.
She came in and fit right in, and as somebody just noted, the three amigos. And that's what it was. And I think that's a
It was
big
a
part of
perfect
it.
fit.
As a team,
Definitely.
that's how it needs to be for it to work.
Kimmy also comes to provider's office and educate them about our services too, especially on the hospitals that we have screening events and all that kind of stuff.
Yeah, so it's great
Yeah.
that she can go in there. Carmen will go sometimes as well, and they provide an informational opportunity for these provider offices who may not know about us either, or some of them do, some of them don't. We've had turnover. You just never know. So that's a big part of it too, is our providers, our doctors, our nurses, whoever they are, need to know about the program so they can share it with with their patients. So
Yeah.
that's an important role that she really does as well. So
Wow.
Yeah, it is an important role because lately I've been receiving a lot of calls from patients who are being referred by the providers from different places because they don't have health insurance and they didn't know that the program exists. So the providers are promoting our program.
Good. Very good.
they're a big part of what we do these days. Yeah.
And you were just hearing the voice of Carmen Rodriguez.
Here she is. Drum roll, please.
Hi, hello.
You are the case manager. Explain to our viewers exactly. You were saying some things, but tell us more about what you do.
Okay, as a case manager, I am the person who contact any of the people that Kim recruit and I schedule them for the screenings for cervical, breast, and colorectal. And my role is to helping them to break any barriers for them to go to their appointments. I helping them to set up the appointments, make sure that if they need transportation, I set up transportation for them that we provided. And I also helping them with the language barrier. I am a interpreter and medical interpreter certificate, and I am able to helping them with their appointments when they're coming over for a screening.
That is something. And that's what I really was so impressed by when I had interviewed you before, the fact that you can, because to me, I have such a bonding and a love with the Spanish-speaking community all over. And anywhere I can help, I want to. And you can help be the go-between of people speaking and understanding.
Yes.
And I think that is, I'm so impressed by that. I am. What a help that is. What a help. That means no one is left out. No one's left. We don't want to leave anybody out.
That's right.
And also, if I am not able to go to an appointment with them because maybe I have other events or something in my schedule, I am able to ask the provider to utilize the language line. Any of the hospital systems has a language line, and as any other language that are set up for any other speaking language.
Not just Spanish.
Yeah, not just Spanish.
Oh,
And
really?
iPads too. Some
Yeah.
of the providers have iPads.
Oh,
So they
okay.
can do a translation as well.
Oh, not just Spanish. Okay, that's wonderful.
Right? It's amazing.
Gee
That's an
whiz.
opportunity that a lot of people, I'm sure, do not know.
Mm-hmm.
So that could be a hindrance for them to get screened, not knowing that somebody has that opportunity to offer
yes,
them
yes.
translation at
Right.
at an appointment, whatever it might
We
be.
also handed out, as Kim do the outreach, she's being able to hand it out information in any other different language. She's been handing out flyers and
brochures.
Spanish, the brochures, and then
Oh my God, we have Russian,
Yeah, yeah,
Chinese,
I was going to ask you, what are the other
any,
languages?
any other
Asian.
languages.
We have everything you could think of,
Yeah.
pretty much.
Okay.
They've thought of it all. So,
Wow.
and it's because we asked. I think over the years, has the population changed for us? We've realized these are the things we need, and the
Yes.
state listened, and so they supplied those
great.
to us. Yeah, it's awesome.
That is. And how long have you been working there, Carmen?
5 years with Cancer Services Program, but I was having a partnership for over 15 years with Cancer Services Program with my part-time job to life that I is still working with.
Carmen and I go back that far.
You do?
Yes.
Okay.
Yeah. Yep.
Wow.
It's amazing, right? 20 years? That's insane.
That's something.
She just hit her 5-year mark at the hospital and got her 5-year award. And
Really?
Yes. So,
Congratulations.
Thank you.
we're happy to have
Wow, you
her.
get folks working with you. You don't let them go. do
Why
you?
would they want
Saying.
to?
She don't let people go, does she?
We are family.
I see that.
We're going to be singing that at the end of the show.
Hey,
Now I know
give
what
me an
song it
idea.
is. But it's true. And I think that's part of that fit.
I
It's
love it.
part of the relationship. And,
Yeah.
you know, we stay together for a reason. We all love what we do. We care about the communities. And I think that's important that everybody knows that as well. It's in our heart.
Sure.
As you
Yeah,
noted,
I
we
can
have
tell.
angel,
Yes.
angels. We got it all
Wings,
going on.
halo.
So, but it is. It's part of you. And
Yes.
we discussed that yesterday, actually on a webinar, and they asked, why did you get into this field? And personally, for me, ironically, it just showed up on my doorstep. I wasn't looking for it. So I just became an advocate out of nowhere, pretty much. So it was interesting. A lot of people had a reason why they got there, and I'm like, I don't have one. It showed up on my doorstep, so there was a reason why,
Yes.
So here I am 25 years later.
I love it. And viewers, I want to say to you, these are the pieces of the puzzle that make it fit, that make it a success. Because if they're feeling like this about each other, can you imagine how they're going to feel about you and you getting yourself getting taken care of, getting screening, getting tested? If they're interacting with themselves, they're going to this is going to trickle right over to you out there.
We love our patients. Are
Yeah.
you kidding?
We
We
never
have
give
friends.
up.
We've befriended a Carmen will call them 5 times, maybe more. But we've befriended a lot of our patients as well. So I have an Amish woman that I've become friends with. I went to her daughter's wedding. I mean, it's amazing the relationships you can build. So we want everybody out there to know we're here for you. It's what we do. So, it is at the end of the day, that's what it's about, is getting them screened and whatever else they need.
Well, when you're talking about, breast, cervical, and colorectal screening, you have to feel comfortable with those people that you're talking to them about. I mean, who better than the 3 of us?
That's right.
We have friendly faces, and
Yes.
the banter is very friendly. So, we make everybody feel happy and welcome. So,
We're like, come on, do that kit. You know you can do that colorectal kit. You do it. Put it in your
Yeah,
bathroom.
that's nice.
It's how it goes. But
Yeah.
can I take a step back? And I just wanted to tell a little bit more about the program.
Of course.
So, we talked about ourselves and kind of what we do with it.
Yeah, because I was going to ask you next to tell us about
a
the
lot of
actual
people might not
program.
know too much. So the program provides breast, cervical, and colorectal cancer screenings, men and women 40 to 64, and 45 to 64 for colon cancer screening specifically, but breast and cervical 40 and older for the women. It's free if they don't have health insurance, and if you're underinsured, we call it, so you might have health insurance, but certain things aren't covered that our program could support. We do help with that as well. So we, case by case, we kind of review it to make sure that we can provide them with a service. Did I miss anything there? Sometimes I just say it and I don't know that I said it all or not. But that's we're funded through the New York State Department of Health and the Center for Disease Control. So our dollars are funded that way.
That's
So-
something.
But those are the basics of the program.
Yeah,
there's much
sure.
more.
Yeah.
Carmen has another piece of that with the program.
Yeah,
and I'll let her share that.
yes.
That we provide a service as well. But that's the basics. So you heard us talk about breast, cervical, and colorectal, but that's what we provide. So those are the 3 services that we do.
And we've just gotten renewed for our next, our
yes.
grant is 5 years. So October 1st, we got renewed for another 5 years. So we're not going anywhere.
That's
Oh,
right. Yeah, we're
This
in.
is for another
stay
5
here.
years.
That's right.
Yes.
We're in year 1, and
That's
September
great.
30th, the next year starts October 1st, and we'll have 4 more years after that. So we got re-granted. We wrote the grant. Like I said, 15 years. This is now another 5. It's great. 20. I'll be at
beautiful.
20 at that
Yeah,
point. When this,
yeah.
and then there'll be another one.
love
Don't
it.
worry.
Because that was actually my next question was the actual program. So if you don't have any, sometimes people think that everybody has medical insurance and they don't. They don't.
People don't want to talk about it sometimes. They feel insecure about the fact that they don't have health insurance, embarrassed by the fact that they don't have health insurance. So we really tried to stress, don't worry about it. That's why we're here. Some people will say, hey, I don't want to use the program. Save it for somebody else. And I'm like, it's for you too. So use it.
Yes. Do you find that as well, Kim?
I do. A lot of people, post COVID, a lot of people lost their jobs. Small businesses had to close. They couldn't afford it. So those folks don't have insurance. Then you also have people can't afford it. So, you have to choose between, paying your rent or mortgage or paying for your health insurance. So they opt, not to take the insurance. So we've had a lot of people come through that have had that situation. So it's definitely out there.
Sure.
It's just a matter of finding those people.
Yes.
And then making them feel comfortable enough to come talk to us about it.
Yes.
Sometimes it takes them a little while. They want to reread the information that I give them, but they come around. We get them.
Yes.
We get them. We're going to get you.
We're going to get you.
Tell them right there.
We're going to get you. We're coming for you.
And I think sometimes also is it takes time. So somebody might pick up a flyer or a brochure, and we found that it's 3 to 6 months until they act on it. So I think that's a big part too. There's no result that quickly. It
Okay.
takes time for people to realize,
Yes.
oh yeah, I do need that screening right now. It is time.
I see.
So
Sure.
that's when it comes around too.
Wow, that's something.
Carmen has another
Yeah,
program
I
that
was gonna
we
say.
that we provide as well.
You can go ahead, Carmen.
When we receive calls from people who are uninsured, I make sure to educate them and tell them that we are here for help you, that we have a monthly screenings events where we do one here in Schenectady at Ellis McClellan, where our provider do a clinical breast exam and a pap smear if it's necessary. And the same day, they will go to Bellevue to the Breast Health Center and get their mammogram done. If the patient wants to come over another day for their mammogram because their thing is a long day, we can do those two first tests the day, and we can do the mammography and another day or in the following month that we will have the screening event. And if there have any barriers as transportation, child care, or any other barriers, we helping them to break the barriers for them to come over for their appointments. I always call them. I always send a letter, text message, or email them to remind their appointments and to be sure that they're confirming that they're agreed to come over to their appointments. If they cannot coming over, I can reschedule them for any other month.
And we work with 5 healthcare systems as well. So we work with Ellis, Bellevue, and Saratoga Hospital, St. Mary's Hospital in Amsterdam. We do Nathan Latour Hospital in Gloversville and Best Healthcare as well. So we have 5 systems that we work with that we provide options in each of our counties. Or if you want to come to a different county, you can. There's no, you can't go to that county. But if somebody lived in Saratoga and they wanted to come to Amsterdam because that's where they want to go, they can.
I see.
So they could go to St. Mary's. So that's part of it too, is we want people to feel comfortable with the healthcare system that they're utilizing.
Yes.
Maybe their provider already works for Nathan Latour Hospital, right? That they've been going to for years and they lost their health insurance. Well, now they can go there on behalf of our program. So, we're able to work with them. I think
It doesn't matter where are you from. You can be downstate, and then you prefer to come over and talk to Carmen Rodriguez. I am here for you.
And that's another thought. Every county in New York State has a cancer services program. So some partners might have 3 like we do. Some might have 5. Some could have 2. It just depends on the area. And you can cross borders. Doesn't matter. But every county in New York State has a cancer services program. So that's a lesson for people to know because people might move out of Montgomery County and go to Herkimer County and they want to stay in their county. So they can do that. It doesn't matter.
Yes.
Yeah.
Wow.
There's one everywhere.
Well, if you're just tuning in, I am talking to some really fine ladies who I just have the utmost respect for. I have Suzanne Hagadorn here, the program manager of the Cancer Services Program, Fulton, Montgomery, Schenectady County. I have Kim Rodecker, the outreach coordinator, and I have Carmen Rodriguez, the case manager. And again, they are all here representing the Cancer Services Program, and they're covering Fulton, Montgomery, and Schenectady counties for over 15 years. They've been around a long time, and they are located at St. Mary's Hospital, Guy Park Avenue in Amsterdam, New York. So before we go any further, ladies, and again, welcome you all for coming. Thank you so much. I appreciate you coming.
We love it.
You do.
Isn't it great?
Yes,
I mean,
it is.
we're sharing all this information
Yes.
and we thank you specifically. You're our little gateway keeper, for the community.
Yes.
She's your girl.
I am.
But, I think it's important that we have someone like
Yes.
you on our side.
That's right.
So it
Amen.
helps us. We really
Amen.
appreciate you as well.
So do all of you have the same numbers? Because before I go any further, I want you to tell the viewers how to reach you. We'll start with you.
We're just going to do the main number. We have a
okay.
main number, and then you can press the button with whoever you want.
Okay.
All our names are there, and it tells what we do. So our number is 518-841-3726.
Okay.
Anytime.
And
They
is
can
there
leave a
anything
message.
on the internet how they can look you up?
Well,
or-
we have a Facebook page, Cancer Services Program of Fulton, Montgomery, and Schenectady County. So they could just go to our page. That's where we share a lot of our information. Kim will put up all the screening event info. And if it's a special month, we'll make sure we're sharing, screening information and things like that. And then we have our Facebook page,
Right.
Cancer Services FMS.
Right.
I just want to
That's
make sure I
solid.
had that right. Thank you, Kim.
So our Facebook page, I try to overload it with as much information that's this month. Is
you
Men's
do it?
Health
You actually
Month.
do it?
I do it.
You
yeah.
do it,
I
Kim.
do.
Okay.
I'm the gatekeeper of our Facebook page.
Oh, cool.
I jump in on
Cool.
occasion.
Yeah. Well, between Sue and I, we keep track of it. This is Men's Health Month. for
Yes,
instance. So
yes.
We're really pounding the information out there about men getting screened,
Yes.
staying on top of it. So, those important months, October for, the women, we really pound out any kind of breast cancer stuff. And then we do all of our screening events on there. You can find those on our page. We share things with other groups that are out there. So Sikkim here in Schenectady has a food pantry. We share that. Our friends over at Bethel Northside, they have a food pantry once a month. We share that because those are all people that we work with. So we really try to get a ton of information out there.
Wow, that's wonderful.
We have some awesome community partners,
Oh,
so they're
I
very
can
helpful as well.
imagine.
And
Yes.
that kind of outreach, Kim has built these relationships.
That's
It's
wonderful.
phenomenal. 2 years.
Yes.
2 years, we said. See?
Oh.
She's rocking it.
Hey, meant to be here.
That's
Meant
right.
to be here.
Absolutely.
Meant to be here.
I called her.
So I'll get back to you, Carmen, because I wanted to ask you a few other things, and then you as well, Kim. But Suzanne, let's talk about. And I definitely have here on my list about the men. We do not want to forget about you.
No.
This is tell us it's Men's Health
Men's Health Month. And this week is Men's Health Week. And it's always the week before Father's Day. So, we're really trying to educate the men, talk about getting your colorectal cancer screenings. Yes, men get breast cancer too. So that's also another point that, men should know. 2% of the population-ish. But men can get breast cancer too. So that's an important fact. They have breast tissue just like we do.
And do you help men as well?
Yes.
You do. So men, you can be helped also.
If you have a lump and you feel it, you call us.
Yes,
Because
please.
we've had men do that. They've come through. They've gotten ultrasounds. They've had a biopsy. So we do offer those services as well. And Friday is Go Blue Day. As you can see, we're all in blue today. How
Yes,
ironic.
I know.
And Friday's Go Blue Day. We're blue for men. So if you want to wear blue for men and send us a picture on Facebook, please feel free to do so and post it to our page or send it to us through Messenger, and we'll put you up.
And then that's June the 14th is Go Blue Day. And then the whole month of June is Men's Health Month.
Right, correct.
And then now you all were wearing blue.
Yeah.
I just so happens I'm wearing blue.
Ironic.
What was going on with that?
It's just that it's a recognition thing for men's health.
Recognition.
Yeah, for
Okay.
Men's Health
Oh, I
Month.
see.
And, we figured it ain't Go Blue Friday, but we'll go blue today. So.
Cool. That's good.
Kind of
Wow.
funny. And it's kind of like a recognition
Yes,
color, I think.
yes.
And if we talk about March is Colorectal Cancer Awareness Month, which is also blue.
Mm-hmm.
So, we kind of spun it there a little bit.
Wow, that's
Ended it.
something. Well, we're just about out of time for this first part one, but I wanted to just go back to you, Carmen, about when you have to tell someone, say someone has a screening or a test and something is found, you're the person that lets them know, correct?
Well, we have to wait for the provider to let them know first.
Okay.
But after we receive the reports and we know that the provider already tell them, I make a call and try to explain it to them that sometimes when you need to go for additional imaging, it's not because you have anything. They just wants to make comparisons for the views that they were taking the day because they don't have any backup. And if it's something appear, well, sometimes it's just something that they need to do to find out that anything is wrong. And I try to explain that to them for them to stay calm until the day that they have their appointment.
I think that's a big part too, is the people knowing and feeling comfortable. She's your girl. She'll make them feel comfortable and to not worry. That's a big part. You don't know what you know till you know.
Yeah.
That's kind of how I look at it,
Yes.
And we reimburse. We pay for all those things. So if they needed extra views on a mammogram, an ultrasound, if you go for a surgical consult, because you may have to go to that level with a provider, and then if there's a biopsy, and it just continues, and she follows them from start to finish. And if they go and they need cancer treatment, we have another program that we can provide them with.
Isn't that something?
Yeah, the other program is the Medicaid treatment program that we are able to enroll the patient for them to get a Medicaid insurance that is for the treatment, but it's good for any other services.
Oh,
Everything's
okay.
covered.
Okay.
So dental, vision, whatever they might need.
Is that something?
Yes, yeah, it's really
Wow.
nice that they have the full coverage, not to worry about anything.
Not to worry.
while they're doing that.
And there are so many new people living up here now in the Capital District. You know, I'm meeting people all the time who are a lot of people from New York City are up here, but they're from all over, the South, the West, East, other parts of the East. And so if you're someone who's here, living here, and you don't have medical insurance, and the fact that maybe you're uninsured, please call them. Give your number again, please.
518-841-3726.
Okay. So another quick thing for you, Carmen, and then we're going to wind this up and then we'll go into part 2. But, okay, so I just wanted to find out about the statistics of, women of or maybe Suzanne, maybe any of you could answer this. Any of, because people of color, I have to ask this because you always hear so many things that we have been going through, and the viewers need to know how that's made up of, because you hear so much about, and it's not just African Americans, it's anybody that's that's considered a minority it could be, tell us about that.
Yeah, it could be somebody who's Spanish speaking
Or
whatever it might be.
or Guyan. We have a large Guyanese population
we have
here.
a very large Guyanese
right in
population.
this area, so
They
many.
come through our program.
Yes.
So, and they're very compliant. They follow through with everything.
Yes.
So yes, one of our focus populations actually is the Black-brown population. So, and because they're not getting screened, because maybe they have a fear of being discriminated against. There's a lot of different avenues there with the population. Not knowing that they are more susceptible to cancer. There's just different pieces, I think, with many of the populations. They've reported that they aren't getting screened as often as someone of a different persuasion, Caucasian, whatever it might be. And, so the survival rates are lower than white people. It's very interesting how over the years, and we're just starting to learn, and I did bring some information with me, and they have a higher death rate of cancer overall. So not just the cancers we're talking about, but in general. And the big part of that is because they're not getting screened. So we're pushing you. Kim's working with a lot of churches.
Good.
So we're hoping that we increase those screening numbers through that.
And you men,
Tell them,
talking
Kim.
to you men, you need to get your screenings, because the men are the biggest culprits of not going to the doctor, not wanting to get screened. They don't want to know.
No.
And then the other reasons that Sue mentioned too, sometimes they feel like they're discriminated against, but
Yes.
it doesn't matter.
Sure.
We don't care who you are.
That's
we will
right.
screen you.
Yes.
We will screen
I like
you.
that.
Yeah.
So we're going to wind up part 1, but please come back next week for part 2. Thank you, ladies. I am so grateful for these ladies for coming. Please call them.
Thank you.